Hello kiddos, this is Master Ayatollah General Instructor Chairman Thorson coming to you from Bunker 167. Today we are talking about Chapter 19, Policy Making when it comes to healthcare and the environment. So let's get started. First thing we're going to talk today about is healthcare, and just to kind of give you a little bit of background information, America actually surprisingly lags behind some other countries when it comes to healthcare. We do not have the highest life expectancy in the world. We're probably about fifth on that. Scandinavian countries, Japan, they have higher ones than us, and we also have a higher infant mortality rate than many industrialized countries do. We also have the highest costs of any other country in the world when it comes to our healthcare. We spend about, as of today, 1/6 of our GDP on healthcare. Why is that? Because we have the highest technological advances in any other countries in healthcare. Insurance companies raise the rates, and that causes a lot of money costs towards people, but also malpractice suits have been rampant as of recent, and because of that, doctors have to pay for higher insurance rates for their malpractice suits. Therefore, they put the cost on their patients. Healthcare has been and still is today a major controversy in the United States. One of the reasons is so many people are uninsured. A few years ago, about 46 million people were uninsured. As of today, it's about 40 million once the Affordable Care Act, or as many people know it being called Obamacare, was passed. Health insurance is tied closely to race and income. Basically, the higher amount of money that you make, the more amount of money you make, the more likely you are to have health insurance. And one of the major reasons that people don't have health insurance is because they either lost a job or are between jobs. There are ways that people, there are different plans that have been offered to people that can make healthcare more affordable. One of them would be HMOs, or health maintenance organizations, where people pay a yearly fee to have this. They pay this hopefully to kind of keep costs low, but at the same time you're very limited to the amount of healthcare you can get. Very few doctors use HMOs anymore. But once the Affordable Care Act, or Obamacare, was passed a few years ago, it basically said that all of those that are uninsured cannot be uninsured anymore. All Americans have to have health coverage, but to help with the cost, the government does offer health insurance plans that are provided by them to make costs a little bit lower for people. Compared to many industrialized countries, especially those in Western Europe, the government in the United States plays a smaller role than the governments in most countries, but it has increased once the passing of the ACA happened a few years ago. A lot of countries have what is known as a national health insurance, where it's a compulsory or mandatory insurance program where you have to be on it, but the government pays for everything. Now, with the Affordable Care Act, the government doesn't pay for your health insurance, but it does say you have to be on it and provides that option of a lower cost insurance through the government program. Some things that the government does provide, and has been doing this since the LBJ administration, are Medicare and Medicaid. Medicare is health insurance provided for those over the age of 65, and Medicaid is public assistance for those who are below the poverty line, who cannot afford health insurance. Both of these are provided by the government through tax. There are many different groups that play a part in the politics of healthcare that are getting involved, and it kind of leads to uneven government involvement with healthcare and who they provide the benefits to. The elderly, of course, work with the Medicare, and they want to make sure that they get the best benefits for that. Businesses work with the government when it comes to healthcare, of how much that they are required to provide. For instance, with the ACA, businesses who have over 50 employees are now required to provide health insurance, or they get penalized. Insurance companies also work with the government. A lot of the insurance companies, when the ACA was being passed, didn't really like it, but the government kind of made a deal with these guys, made a deal with the interest groups, and they seem to like the situation now. In the last three presidencies, we've seen each of these three presidents try to do something with healthcare in the government sector. Clinton, when he was president, he tried to guarantee healthcare coverage for all. Actually, Hillary, too. This was her big push when she was the first lady. He felt that you could pay for it by the employers to pay a premium on their insurance and pay premium and taxes, raise the cigarette tax to help pay for this. But interest groups lobbied hard against this, and with the Republican-controlled Congress, it was hard to pass, and it did not pass. With President Bush, we saw the extension of a health savings account where people could put aside money in their paycheck tax-free for health care services. He also included a prescription drug benefit in Medicare for the elderly. Obama, of course, under his presidency, passed the Affordable Care Act, also known as Obamacare, which required many different things, the big provisions including that all people are required to have health insurance and that any employer with over 50 workers must provide some type of health insurance. Some issues that the government has to focus on when it comes to healthcare in the upcoming years is the cost. People are very upset and worried about the cost of healthcare and how it keeps constantly rising, and really research shows nothing is really going to stem that cost, so we're trying to figure out different ways the government can lower costs. Also, we're seeing the controversy of stem cell research. Should it be funded by the federal government or not? Conservatives think no, but liberals and the Democrats think yes. Medical rationing is also thought to be done. That would be something that would be controlled by the government, but that's something that is very controversial and probably won't get passed. Next, we'll move on to the environmental policy. It basically happened after a woman by the name of Rachel Carson in the 1960s came out with the book Silent Spring, where she basically showed everybody how gross the environment was. People were looking around themselves and saying, ugh, this is disgusting. We need to do something about it. So the government stepped in and created the Environmental Protection Agency, EPA or EPA. And their job was to regulate any type of environmental problems, especially with like toxic waste in the environment in the United States. And they are one of the largest federal bureaucratic agencies in the country today. Another thing that was passed by the government was in the 1970s. This was the Clean Air Act, which basically charged the Department of Transportation in finding ways to reduce automobile emissions. They kind of came up with a few years later, actually a couple decades later in the 90s, a thing called cap and trade, where it basically said, it gave this idea that the car companies could only have so much of the car emissions in each vehicle, but if they were able to create vehicles that had lower emissions, it could kind of balance out the other ones. So like if, you know, Toyota has its trucks that emit a lot of CO2, but they have the Prius that doesn't emit as much, they can balance it out and kind of have an average emissions rate. In 1972, the Clean Water Act was passed to clean water, get the pollution out of water. It was meant to clean many of the nation's rivers and lakes, and it did help many of the rivers and lakes in the United States that were beyond the point of pollution get clean, but they didn't really account for in this bill the idea of runoff pollution from city streets and different areas that go into these rivers and lakes. The U.S. is one of the world leaders in wilderness preservation. This started back with TR when he claimed a lot of the land in the West and in the United States to be reserved for national parks and for the governments to protect. They basically are controlled by the national government now. I know that in the 2000s, George W. Bush had proposed that the state should decide what to do with the wilderness areas, not the national government, but nothing passed with that. Another act that was passed to help with kind of wilderness preservation was the Endangered Species Act, which basically the government actively monitors what animals would be considered endangered and makes laws against hunting them. To deal with nuclear waste problems, the government created in the 1980s the Superfund, which was provided money by Congress through tax and chemical products to clean up hazardous waste sites. It basically eliminated hazardous dumping, but it didn't necessarily clean up already existing sites. So it's kind of a wash of whether or not it was successful. Nuclear waste still kind of presents itself as a serious challenge. Like in Nevada, for instance, there's a place called the Yucca Flats that is home to a lot of nuclear waste that's been causing physical damage and harm to people. But at the same time, we have not seen the expansion of nuclear power since the 1970s. A new plant has not been built since the 1970s. So there's another example of how the government stepped in and basically made it nearly impossible to create more nuclear waste. The last type of policy we're going to talk about today is energy policy. And if you look at this chart, you can kind of get an idea of what we use for our energy in the United States. The plurality of it is oil, which is 40%. After that, natural gas and coal are tied about 22%. And then renewables about 7%, or green energy is about 7%, which a lot of environmentalists want to increase that number. And the government has been working towards increasing that number as of late too. If you add up how much we use in oil, natural gas, and coal, it makes up about 87% of what we use in our nation's energy. Coal is the most abundant of all the sources, but we don't use it as much as we used to because of how dirty it is and how much it hurts the environment. And when it comes to oil, of course, it's a major controversy because most of our oil comes from overseas, so it makes us dependent on foreign oil and to those foreign countries, especially in the Middle East, and of course to the group, the cartel OPEC, the oil or Organization of Petroleum Exporting Countries, that is mostly in the Middle East, Nigeria, and Venezuela. Out of all the sources of energy, one of the cleanest is nuclear, but it's also definitely the most controversial. Just to kind of give you an idea of how much oil we have and how much we use more oil than any country in the world. We have about 2% of the oil reserves in the world, but OPEC, who we depend a lot on for oil production, 68% of the world's oil comes from those countries. Yet we use about 30% of the world's oil every day, 19.8 million barrels of oil a day the United States uses. A big controversy that many people in politics talk about with the energy problem is global warming. The Earth is predicted to warm between 2 to 6 degrees by 2100 due to carbon dioxide emissions, and it could cost the United States and the world about $5 trillion if that were to happen. Now, the United States is the leading producer of carbon dioxide emissions, but they did not ratify what was known as the Kyoto Treaty, which was created in the late 90s, early 2000s, that were trying to get greenhouse gas emissions down. President Bush decided not to sign that. So a lot of places are taking matters into their own hands. States like California, for instance, which is one of the most polluted states in the country, has been working to reducing its emissions. A lot of car companies try out their new cars in Southern California, just that are green cars, renewable cars, electric cars, hybrid cars. The reason the environment really cleanup is such a political issue is because of the fact that a clean environment is a public good. It's not something that's a private concern. When it's clean, everybody's benefiting. You can't just have clean air and say it's only for certain people who want it. Everybody gets it. Plus, when we saw in the 60s and 70s the people looking around themselves, seeing how disgusting the planet had become, they realized that they wanted to form groups to fight against this, and because of this, they put a lot of pressure on the politicians to make some changes. But there are people who oppose strict environmental laws. They say it's way too expensive, it's going to hurt the American economy because it's going to keep businesses, it's going to pile on regulations on businesses that could hurt them and cause them to slow down a bit and cause prices to increase. Others say on the other side, it doesn't matter if it costs a lot, we got to make sure that we've got a clean, healthy environment. You might be wondering how in the heck healthcare and the environment and energy connect at all. Well, the issues when it comes to democracy involve all levels of government, but because in the healthcare business and the environment and energy really does require high-tech issues, it really limits citizens' participation. You really have to know a lot about healthcare and a lot about insurance and the environment and energy and all that kind of science to really understand how to change this and what needs to be done. And that really does limit a lot of people because not many people know that kind of stuff. So really, if things need to get changed, groups are the ones that really change this. When we've talked in the past about how different interest groups can get things done, well, in this case, it wouldn't really be mass mobilization as much. Maybe a little bit with the environment and the energy, but not with healthcare. When it comes to the scope of government and healthcare environmental policy, it's pretty common sense. The more people want healthcare, the bigger the government will grow. The more the government does with environmental law, the bigger the government will grow, the more it will cover. But because there's such divisions about healthcare and the environment, it's going to be incremental change. It will not be fundamental change because all of these decisions are going to be based on compromise. There's no real way that these laws that are going to be passed are going to be a complete 180 fundamental change. The moral of the story with this chapter is this: technology is very important to both healthcare and the environmental policies. Advancements in healthcare have improved health, have improved life expectancy in the United States, but it's also increased costs as well. And advancements in environmental improvements in green energy have improved our quality of life, but it's also increased the cost of doing that as well. And the government, the more it takes stuff on, the more and more it's going to continue to grow when it addresses things like healthcare, especially with the Affordable Care Act and the environment. And that's it for today. I'm Mrs. Thorson, out.